until the colonoscopy.
And right now, we're answering your questions about colon cancer. Joining me in studio now is Dr. Edward McCarron, a surgical oncologist at MedStar, Franklin Square. Thanks so much, doctor, for joining us.
Oh, thank you.
Tell us about your role in terms of treating colon cancer, the patient.
So, Kelly, colon cancer patients have a large number of specialists involved in their care. Really, it all starts with the primary care physician that encourages them to get a colonoscopy. The gastroenterologist will then do the colonoscopy and potentially find the problem. Then they progress through a number of specialists, including colorectal surgeons, medical oncologists, radiation oncologists, and me, a surgical oncologist. So my partner, Dr. Vinay Gupta, and I specialize in the removal of tumor deposits from the liver.
Now, I know that colon cancer, we all know that colon cancer is treatable, but you do hear cases about it spreading to the liver. How common is that? So approximately 60% of patients dealing with colon cancer will develop a tumor deposit in their liver throughout the course of their disease. So my hope for patients is that they undergo screening colonoscopies, get diagnosed with early stages of disease, and really never develop a metastatic tumor deposit. And what about for the people who find themselves, though, in that situation?
So the patients that find themselves in that situation, so if they develop a large number of tumor deposits throughout the entire liver, they require treatment with chemotherapy by a medical oncologist. If the tumor deposits are limited, then surgery is their best option. So surgery can be done to remove all of those tumor deposits. Some of the patients aren't healthy enough to go through the stress of an operation. So those patients can be treated with ablation, embolization, or radiation treatments. The ablation procedure takes a probe and can burn the tumors with microwave energy. The embolization technique puts a catheter into the vessel feeding the tumor, and that vessel can be shut off. At Franklin Square, we use a CyberKnife device to shoot radiation beams into the tumor to kill those tumors.
CyberKnife is some pretty amazing technology.
Oh,
prognosis for those folks, quickly?
So quickly, I can say that surgery is always performed with the intent to cure patients, and I can tell you the team at Franklin Square always looks to offer our patients long-term survival, but most importantly, we want to optimize quality of life.
All right, Dr. McCarron, thank you very much. One of our many fine experts here from the MedStar Health Cancer Network. The number to call to get your questions answered, because we're going to have them until about 6:30, 410-671-0702. Get your call in, get your questions answered. I'm going to send it over